Hi, I'm Kat, and today I have for you a true crime case, a word in Romanian, and I will also be doing my makeup at the same time. But before we get started, I just wanted to thank you so much, guys, for being patient with me and for understanding my struggles and for waiting for me until I'm ready to come back with another video. It's been a rough couple of weeks, if I'm honest with you. Actually, the last 2 years have been really bad for me, but I keep on trying to, move forward and yeah, do the best that I can in the situation that I'm in, which doesn't seem to be ending. But anyway, I'm okay. So yeah, like I said, these videos, they are the only things that are keeping me from going insane. But this time it didn't really work. This didn't really work either, so I just kind of slept it off. Just slept it off. And now it seems that I'm feeling much better. So I just wanted to thank every one of you for the words of support that you've written. Okay, so the word for today is neonatal. 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 Well done, guys. You just said neonatal. Oh, I have to tell you that I have been following this case and I have actually been anxiously waiting for the verdict because I really wanted to do a video on it, but I didn't want to do the video before the trial is over. And I'll have to say that at one point I believed that there will be a mistrial because the jurors just took a very long time to deliberate, and then the judge had to make changes and allow for a majority verdict rather than unanimous. So I was thinking that perhaps they can't really point the finger. But anyway, you've probably heard of it if you are in the UK because it's all over the place, it's everywhere. Nurse Lucy Letby has finally been convicted of murdering 7 infants and trying to murder 6 more as a neonatal nurse in Chester Hospital in Cheshire, England. She was sentenced on Monday, 21st of August, to life in prison, and she is considered to be the most prolific child serial killer in United Kingdom history and one of Britain's worst ever female serial killers. I have to say that this is a horrible, horrible case, you guys. Those poor babies, they never had a chance. Lucy's trial actually began in October 2022 and it only ended now. She, of course, pleaded not guilty to all of the 22 charges against her. During the trial, Lucy even claimed that the deaths of the babies could be related to plumbing issues in the hospital. She said that they had raw sewage coming out of the sinks onto the floor in Nursery 1. She also claimed that staff were not able to wash their hands and that could have as well contributed to the babies' deaths. However, when prosecutor Nick Johnson delivered his closing arguments in June 2023, he alleged that Lucy Letby used lethal air injection on at least 12 of her victims. He said that the air injection was one of her favorite ways of killing or trying to kill the babies. And honestly, I won't possibly be able to cover all of the information in one video, just in this video, because there's simply a lot out there. So what I'm gonna do again, with another video, I'm going to split this into 2 parts. Lucy Letby was born in Hereford on 4th of January 1990. She's the only child of John and Susan Letby. Her parents believed that she was innocent and they actually attended every day of the court until the day of her sentencing. And we'll talk about that later on. Lucy earned her qualifications as a children's nurse at the University of Chester in 2011. She started working at the neonatal unit at the Countess of Chester Hospital on 2nd of January 2012. In 2016, she bought a house close to the ward that she worked at. Now, I'm not sure if you know, but here in the UK, I'm not sure if this is how it is in other parts of the world as well, but here in the UK, a lot of hospitals, they have around their grounds flats and houses which are either provided by the hospital for their staff, you know, where the staff can go and live and pay rent, or either the houses are being owned by private owners and then they sell on the houses, but there are sometimes houses and flats, they can even be on the grounds of the hospital. Her house is actually described as simple, very childish in decor, her bedroom with fluffy toys, artwork saying "Live sparkles wherever you go" hanging on the wall, lit by twinkling fairy lights. It kind of seems like she's a bit of a child herself. Lucy was actually a social person with friends, and she had an active social life, going on holidays in Ibiza, nights out, and even attending weekly salsa dancing classes. In work, she was trusted and dedicated. She completed her specialist training in March 2014 and would often work in what is called Nursery 1. This is where the most ill babies were cared for. Now, Lucy didn't really stand out in anything, even at her job. She was considered average at her job. She was even described as vanilla, meaning that she didn't really have any special qualities or, you know, nothing like that. So basically, she just didn't stand out with anything. Her job was a normal job. She was average in it. She had a group of friends, a family, a social life, things which would be expected and normal for someone of her age. Her childhood as well is imperfect, with no suggestion that she went through any tough times, no abuse. She didn't suffer any harm at all. She just had a normal childhood. And in fact, she was greatly loved as an only child by her parents. In 2013, in a profile with the Cheshire Standard, Lucy described her job as looking after a range of babies requiring various levels of support and care. Before January 2015, deaths in the hospital's neonatal unit were statistically compared to other hospitals. But during the time that Lucy was a neonatal nurse, there was a significant increase in the number of babies who were dying and the number of serious collapses. Over 18 months from January 2015, there was a significant rise in the number of babies dying and suffering serious collapses at the neonatal unit. The senior doctors became concerned because many of the babies got very poorly, very suddenly and unexpectedly, and then they failed to respond to appropriate resuscitation. Other babies who suddenly collapsed and didn't die recovered with both their collapse and recovery defying the usual medical norms. So the police and medical experts were called in. As they were looking for a reason why this was happening, they eventually focused on one common factor to all of this baby, and this was nurse Lucy Letby. Lucy was first arrested in July 2018 and then again in June 2019 and then again in November 2020 when she was finally charged with murdering 7 babies and trying to kill another 10 babies between June 2015 and July 2016.
Oh, Lucy, is it?
Yes.
Hello, my name's from Cheshire, please. So, can you step in 2 seconds?
Yes.
Yeah, thank you. Yeah, not a problem.
I'm going to put you in the back seat over here.
Hold on, man.
Yes.
Get the seat up.
Okay, just take a seat in there for me, Lucy. I'll move that seat forward a bit shortly.
Yeah, I've just had knee surgery. So
Oh, right, okay.
they told me that there had been a lot more deaths and that I'd been linked to somebody that was there for a lot of them.
Did you have any concerns that there was a rise in the mortality rate?
Yes.
Okay, so tell me about that. What concerns did you have?
I think we'd all just noticed as a team in general, the nursing staff, that this was a rise compared to previous years.
Prosecutors have said that Lucy attacked 17 babies who were on the ward. She poisoned some of the babies with insulin. She would also inject air into other babies' bloodstreams or stomachs, or would give them excessive milk. The victims included twins and triplets, and in one case, Lucy killed 2 siblings on consecutive days. The youngest baby that she murdered was only 1 day old. The oldest baby was 11 weeks old, a baby girl who she attacked 4 times before killing her. Even though these babies were born prematurely, actually some of them were in a very good condition before they suddenly deteriorated, mainly during the night shifts when Lucy was working. Lucy attacked a few babies shortly after their parents left their bedside. But Lucy denied any wrongdoing, and she blamed the hospital and the doctors working there. For legal reasons, the victims and their parents had not been identified, so the babies are only referred to by letters. Lucy's first victim, baby A, was a twin boy who was born and died in early June 2015. He was a premature baby delivered by C-section at 31 weeks, and the baby was admitted to the neonatal unit's intensive care room. The baby boy was stable and breathing without oxygen support on 8th of June. Lucy started her shift at 7:30 p.m. and she took over his care from another nurse. Almost 1 hour into her shift, at 8:26 p.m., Lucy called the doctors to baby A's incubator as he was getting worse very quickly. They actually performed CPR on the baby, but sadly, baby A died by 8:58 p.m. The baby collapsed and died as a result of a deliberate injection of air into his bloodstream. According to medical experts, the key symptoms of air injection is a quick and inexplicable collapse which doesn't respond to treatment, accompanied by the appearance of an unusual skin rash. With baby a few doctors noticed patches of pink over blue skin which seemed to appear and disappear. In a post-mortem x-ray, there was a line of gas in front of the spine, something which was unusual as described by pediatric radiologist Dr. Owens Arthurs. He told jurors that the appearance was consistent with, but not diagnostic of air having been administered. A pathologist who reviewed the case, Dr. Andreas Marnerides, I'm not sure if I'm saying that right, said that it would be reasonable to conclude that the air in baby A circulation was most likely caused by administration of air through one of the tubes connected to the baby. The twin sister of baby A, baby B, collapsed 28 hours after her twin brother died in the early hours of 10th of June 2015. When she was born, baby B required resuscitation, but she recovered really quickly and she was doing quite well. She was stable. At about 12:30 in the night on 10th of June, baby B's heart rate suddenly dropped. Her alarm monitor sounded, so Lucy with other doctors went to check up on her. During resuscitation, it was noticed that baby B had purple blotches and white patches all over her body. A nurse who treated her said that she looked very ill, very much like her brother did the night before. Baby B luckily recovered and she was discharged a month later. Medical experts agreed that baby B was subjected to some sort of sabotage and she may have been injected with a dose of air. Baby C was a premature baby boy who weighed just 800 grams when he was born in early June 2015. Even though he was premature, he was in a good condition and he was stable. He was in Nursery 1, the highest priority section of the neonatal unit for close observation, when, on the night of 13th of June, he suddenly stopped breathing. Lucy caused baby C's collapse at around 11:15 p.m. by inserting air into his stomach via a nasogastric tube. Lucy, on that night, was actually the designated nurse for another child in Nursery 3, but she was in Nursery 1 when baby C collapsed. Even though doctors tried to save baby C, they failed to revive him and he was pronounced dead at 5:58 a.m. on 14th of June. Prosecutor Nick Johnson, King's Counsel, asked medical expert Dr. Sandy Bowen during the trial, quote, "When you looked for a reason for baby C's collapse on June 13, can you find an explanation?" Dr. Bowen replied, "No, babies like this should not collapse. You get prior warning that something is amiss. They don't go from being stable into a cardiorespiratory situation within minutes. They rarely collapse in that way, but they are usually responsive to resuscitation, and he was not." End of quote. Baby D, a baby girl, was the third baby murdered by Lucy Letby in a 2-week period. The mother of baby D's waters had broken on 18th of June 2015, but she was only given a C-section 2 days later after attempts to induce labor. She was not given antibiotics, even though there was concern about her having an infection. The mother said that when her baby was delivered, she looked lifeless and the mother was worried. The baby seemed to be limp, struggling to breathe, and she didn't have an even color. But even though baby D was poorly, she ended up responding well to treatment, and she was not expected to get worse, but she was expected to recover. During the night shift of 21st to 22nd of June, baby D collapsed several times. The doctors were shocked when they saw brown and black discoloration to baby D's skin. Again, despite resuscitation attempts, she was sadly pronounced dead at 4:25 a.m. on 22nd of June. Medical experts agreed that while there was clear evidence of an infection, baby D's deterioration and unusual rash was caused by an injection of air. Baby E was a premature twin boy who was born in late July 2015. On the evening of 3rd of August, his mother visited him in the neonatal unit. When she walked into the room, she could hear the baby crying, but she said it was like nothing she had heard before. She went over to the incubator and she saw blood coming out of his mouth. Feeling that something was not quite right, she panicked, and rightly so. Lucy Letby was standing at a nearby workstation when she entered the room. Lucy told the mother that a register was on the way and that she should go back to her ward. The mother was still in the hospital as well. But baby E later deteriorated and his mother was actually brought back to the unit, where she sat outside in the corridor and watched as doctors tried to resuscitate her baby, but they sadly failed. Baby E lost 25% of his blood volume before his death in the early hours of 4th of August. Medical expert Dr. Dewey Evans said that this could have been the result of an inappropriate use of a medical tool. Dr. Evans concluded that baby E's death was the result of his internal bleed and an injection of air. Straight away, the day after murdering baby E, Lucy used insulin to poison his twin brother, baby F. She was on the night shift on 4th of August 2015. Baby F received a new feed of nutrients via a bag which was connected to an intravenous line. Shortly after, his heart rate went up and his blood sugars were through the roof. Blood samples which were taken from baby F had extremely high insulin level of 4,657 and a very low C-peptide level of less than 169, indicating that synthetic insulin was in his system. Medical expert Dr. Dewey Evans said that there was only one explanation for the astonishing blood readings. Baby F had received insulin from some outside source. Dr. Evans concluded that the drug was most likely added to the baby's feed bag, which is used to intravenously provide feeds to infants. Dr. Evans said that insulin was a very dangerous drug which could cause a sharp drop in glucose levels, and if left untreated, it could lead to seizures, coma, or death. Oh my god, I just realized I didn't have my cat ears on. Oh, I'm so sorry guys, sorry. How did I forget? So again, I'm going to say in case we lost the information for a second. Dr. Evans said that insulin was a very dangerous drug which could cause a sharp drop in glucose levels, and if left untreated, it could lead to seizures, coma, or even death. Dr. Sandy Bowen, who reviewed Dr. Evans' findings, agreed that this was a case of insulin poisoning via the feed bag. Child F's glucose levels had remained low on the day shift of 5th of August, even after a second intravenous line and nutrient bag had been fitted. They rose to safe levels later that evening after the nutrients were stopped and extra sugar was given independently. When it was time for the baby's second feed bag, a decision luckily was made to stop giving the baby the bag. After this, baby F made a full recovery. Baby G was the most premature of all the babies in this case, weighing just 535 grams at birth in May 2015. Baby G had a number of septic or suspected septic episodes which required antibiotics, and she received 9 blood transfusions in the weeks after she was born. In mid-August, she was transferred from Arrow Park Hospital in Wirral to the Counties of Chester's neonatal unit. She was clinically stable up until September the 7th. At around 2 a.m., doctors noticed that baby G had projectile vomited and her abdomen appeared to be purple and distended. Her oxygen levels dropped and she stopped breathing several times over the next few hours. She didn't respond to breathing support on ventilation. The prosecution said that Lucy Letby actually overfed baby G with milk through a nasogastric tube or injected air into the same tube. Lucy was convicted of another attempt to murder baby G on 21st of September. However, she was acquitted of a third attempt. Baby G actually survived, but now she has quadriplegic cerebral palsy and requires round-the-clock care. Baby G's parents testified in court in December. They believe that Lucy intentionally overfed the baby milk and air, leading to irreversible brain damage and the cerebral palsy. Baby H was a premature baby girl who was delivered via C-section in September 2015 at the Countess of Chester Hospital. Soon after she was born, she had breathing difficulties, and with this, she was transferred to Nursery 1. The prosecution did acknowledge that baby H's case was complicated by the suboptimal treatment given to her. There was a delay in intubating her and administering medicine to help her lungs. On top of that, when baby G was put on a ventilator, she was left with butterfly needles in her chest for long periods of time, which may have punctured her lung tissue. The prosecution claimed that Lucy first attacked baby H in the early hours of 26th of September 2015 and then again the next morning after the baby's designated nurse left the intensive care room for a short period of time. However, in the case of baby H, jurors found Lucy not guilty of attempted murder and they were unable to reach a verdict on the second count. The defense said that baby H was just another example of suboptimal care by the Countess of Chester Hospital and had nothing to do with Lucy Letby. Baby I was born prematurely at Liverpool Women's Hospital and then transferred to the Countess of Chester on 18th of August 2015. In the first few weeks of her life, she had a few problems with her breathing, but they were all resolved. On 30th of September, baby I needed emergency attention after she vomited and her heart rate dropped. She suddenly collapsed again on 13th and 14th of October before she fatally deteriorated on 23rd of October. According to the prosecution, Lucy murdered baby I at the fourth attempt by administering a fatal dose of air into her bloodstream. Medical expert Dr. Dewey Evans told the trial, quote, "My opinion was that baby I had been subjected to an infusion of air. In other words, air had been injected into her stomach. that interferes with your ability to move your diaphragm up and down, and that interferes with your breathing. End of quote. Another premature baby, the baby girl, baby J, was born at the Countess of Chester Hospital in late October 2015. Baby J was transferred to Alderhay Hospital in Liverpool on 1st of November because it was discovered that she had a bowel condition which actually needed surgery. After the surgery, baby J recovered quite well, so she was returned to Chester Hospital on 10th of November, where she was stable until the early hours of 27th of November. She then suffered 2 unexplained seizures within a 30-minute period, and she required urgent breathing support. Baby J had not suffered a seizure before. Medical expert Dr. Dewey Evans said that the collapse didn't have a straightforward explanation and it could be consistent with some kind of obstruction of her airways, something like smothering. The defense, however, said that the Countess of Chester was well out of its depth with baby J and knowing how to treat her. They argued that an assumption of deliberate harm was made rather than an alternative explanation of a baby receiving inadequate care. On the case of baby G, jurors were unable to reach a verdict. When baby K was born at 25 weeks, weighing just 692 grams, she was considered in as good a condition as possible for a baby born that early. However, as a precaution, an hour and a half after she was born, arrangements were made to transfer her to a more specialist unit at Arrow Park Hospital in Wirral. While waiting for transport, baby K's designated nurse, Joanne Williams, left her in Lucy's care. By the way, as far as I understand from what I was reading, please correct me if I'm wrong, but Joanne Williams was actually suspended or sacked after this. So Joanne Williams left baby K in Lucy's care just before she got the transfer to the other hospital. The prosecution said that whilst in her care in the early hours of 17th of February 2016, Lucy deliberately dislodged baby K's breathing tube. The trial heard from consultant Dr. Ravi Jayaram, who felt quite uneasy about Lucy being left with a baby. He said, quote, "At this point in mid-February, we were aware as a team of a number of unexpected and unusual events, and we were aware of an association with Lucy Letby. That's all we were aware of. No cause and effect had been ascribed." End of quote. Dr. Jayaram told jurors that when he went to check on baby K, he saw Lucy standing by her incubator. He noticed the baby's breathing tube became dislodged and Lucy was doing nothing to correct the desaturation until he arrived. The baby was given rescue breaths and she eventually stabilized, but sadly she died 3 days later. Lucy Letby was not accused of her murder. The defense said that the probable cause of the tube moving was the baby doing it herself. They added that her case was yet another example of suboptimal care by the hospital. Jurors were unable to reach a verdict on this one. Baby L was a twin boy born in early April 2016. He was stable after treatment for mild low blood sugar. He was moved to nursery 1, which again is the highest priority section of the neonatal unit. He was moved there shortly after he was born. Lucy Letby was caring for 2 other babies in the nursery on a day shift on 9th of April. A few hours after Lucy arrived, baby L's glucose levels fell abnormally low and he had to be given additional doses of glucose trying to correct the hypoglycemia. But they proved ineffective. Blood tests were actually conducted on baby L and they revealed a very high level of insulin in his blood, with the reading being at the very top of the scale that the equipment was capable of measuring. Baby L did actually recover and was discharged from the hospital the following month. The prosecution said that the only explanation for this anomaly was that synthetic insulin, a drug not prescribed to baby L, had been administered. According to prosecutors, this was a deliberate act of sabotage done by Lucy with the intention of killing him. Baby L's twin brother, baby M, suffered an unexpected life-threatening event at around 4 p.m. on 9th of April 2016, at the same time that his twin brother's blood sugar levels were dangerously low. Consultant Dr. Ravi Jayaram, who attended a crash call for baby M, noticed unusual patches of discoloration on his skin, which he believed was similar to what he had seen in the cases of baby A and baby B. Baby M needed 6 doses of adrenaline within a 25-minute period and resuscitation before he was stable. Doctors could find no cause for his sudden collapse. Just like his brother, baby M recovered and was discharged from the hospital the following month. Medical expert Dr. Dewey Evans said that the likely cause of the baby boy's sudden deterioration was actually an injection of air. Baby N was born in early June 2016. In the hours after his birth, he was stable and his clinical condition was described as excellent. But baby N did have a blood disorder which made him more prone to bleeding. The prosecution said that this disorder gave Lucy cover to attack him because if he bled, he would be put down to his condition. Prosecutors said that baby N's 3 deteriorations in June 2016 were consistent with inflicted injury or him having received an injection of air. The trial heard that in the early hours of 3rd of June, baby N experienced a sudden deterioration and was heard screaming and crying for 30 minutes. Medical experts said that the incident was consistent with the baby having been attacked. In the end, jurors convicted Lucy on this count of attempted murder. On 15th of June, baby N suffered even more collapses and bleeding was noticed at the back of his throat. Expert Dr. Dewey Evans said that in his opinion this bleeding was a result of trauma to his upper airway. The defense said that there are many reasons a baby will shout and scream. They also said that baby N was another baby who received suboptimal care and should have been treated elsewhere at a specialist unit. The jury was unable to reach a verdict on these other 2 counts. Baby O was one of triplet brothers and he was actually born in good condition in June 2016. He was stable up until the afternoon of June 23rd when he suffered a deterioration. At 2:40 p.m. he collapsed and he was moved to nursery 1 where he was stable for a time. At around 4:15 p.m. the baby had another collapse which required resuscitation including cardiac compressions, but sadly they were unsuccessful and baby O was pronounced dead at 5:47 p.m. Lucy allegedly asked the doctor if the baby was living alive, as in leaving the hospital alive. A post-mortem examination found unclotted blood in his body from a liver injury and the coroner certified the death on the basis of natural causes and intra-abdominal bleeding. An independent pathologist who reviewed the case said in his opinion that baby O suffered an impact injury to his liver similar to a road traffic collision. Medical experts said that the baby died due to a combination of air being injected into his bloodstream and the injury to his liver. Baby P was actually baby O's triplet brother and he was in the same room as him on the neonatal unit. After the death of his brother, he was put under close observation as a precaution. At 9:35 a.m. on 24th of June, baby P was reviewed by a register and found to be self-ventilating in air and was stable. But only 15 minutes later he collapsed and required breathing support. Baby P collapsed several more times on 24th of June before being pronounced dead at 4 p.m. after 45 minutes of unsuccessful resuscitation attempts. Medical expert Dr. Dewey Evans told the trial that in his view the collapses were consistent with an additional amount of air being given to this baby during the morning of 24th of June. Lucy Letby was found guilty of the murder of baby O and baby P as well. Baby H, the third triplet, was given an excess of air and clear liquid endangering his life. Lucy made 2 attempts to murder the baby. Luckily though, the baby was removed from the hospital at the insistence of the parents and he made a rapid recovery. I believe that the parents, after seeing what happened with their other two babies, they said that, you know, they ended up staying in the room with the third triplet, and then they decided to just take him out of this hospital, which was a great decision, because I really think that if he wouldn't have been taken out of the hospital, he would have been killed as well. Baby Q was born in late June 2016 and was initially stable. The baby got quite ill and needed breathing support shortly after 9 on 25th of June. Prosecutors said that Lucy injected air and fluid into the baby boy's stomach via a nasogastric tube in an attempt to kill him. Medical expert Dr. Dewey Evans told jurors that vomit found on baby Q on the morning on 25th of June was evidence that liquid was given to him by someone. Dr. Evans said that the following breathing problems experienced by baby Q were likely caused by the fluid, which placed pressure on his diaphragm and prevented him from breathing normally. But the defense said there was no evidence that Lucy inflicted harm. The jury was hung on the attempted murder charge. Dr. Ravi Jayaram, who was a senior doctor at Cheshire Hospital, actually testified at trial that he raised suspicions about Lucy Letby to the hospital administration in 2015 and 2016, but he was ignored for months. The Cheshire Constabulary launched its own investigation into the deaths in May 2017 after they were alerted to Lucy Letby's suspicious behavior. The investigation into the murder of 7 babies and attempted murders of 10 babies at the Countess of Chester Hospital is one of the largest and most complex ever undertaken by Cheshire Police. Senior Investigating Officer Detective Superintendent Paul Hughes and Deputy Senior Investigating Officer Detective Chief Inspector Nicola Evans are the leading detectives into the investigation. They said that their team has faced a monumental task in bringing these horrendous crimes to court. This was a long investigation, with the 2 lead detectives speaking of the ongoing and far-reaching impact of Lucy's crimes on their families. DCI Evans said, quote, "It's been a long and emotional investigation for everybody involved. At the heart of that, there are families of babies involved. To put that into some sort of context, we have essentially got 17 separate murder and attempted murder cases running alongside each other, which is huge logistically, and the impact of that is so far-reaching. It's not just parents and babies, they are extended families. The majority of our witnesses and professionals who are still working as nurses and doctors in the neonatal unit and still caring for tiny babies, and mixed into that, they have been in court giving evidence about these horrendous crimes. The impact of that is really significant." End of quote. Operation Hummingbird, as the police named it, began as a team of 8 people and soon grew to almost 70 officers and civilian staff working together. The 6 years investigation involved building a strong case for court, with 32,000 pages of evidence collected and medical records into the thousands of pages looked through. Detective Superintendent Hughes and the DCI Evans said that they spoke to around 2,000 people during the investigation, and almost 250 people who were identified by the prosecution as potential witnesses, even though not all of them were required to give evidence during the trial. There were a huge number of documents to look through, with a lot of complex medical information and peer reviews from medical experts trying to establish just what went on. Around 30 hours of videos were captured during Lucy's arrests. The medical experts used as part of the prosecution case included specialists in areas of pediatric radiology, pediatric pathology, hematology, pediatric neurology, and pediatric endocrinology, with 2 main medical experts, consultant pediatricians, giving their opinions on each baby case and the probable cause of their death or collapse. As far as I understand from what I've read, I hope I understood correctly, the investigation cost around £2 million, which is about which is about $2.5 million. Over the course of the investigation, the team drew on the expertise and guidance of the National Crime Agency alongside the team from Greater Manchester Police who investigated the Stepping Hill Hospital deaths. Killer nurse Vittorino Chua was sentenced to a minimum term of 35 years in 2015 for poisoning hospital patients and murdering 2 of them. He injected insulin into saline bags and ampoules, which unsuspecting colleagues then administered to patients, causing their blood sugar levels to collapse alarmingly. The investigating team also worked with their Gold Group governance meetings of colleagues at chief officer level within Cheshire Police. The majority of the witnesses during the trial were nursing staff still working in caring for tiny babies at the hospital. The detectives said that the victims were tiny babies kept in a room to grow and develop. They were not in a critical condition, but they were very susceptible. It was difficult to actually work out what happened, mainly because it doesn't take much at all to cause a collapse in a tiny baby. Looking at this from the outside, you would think that somebody would notice, but when you hear the evidence and just how delicate those babies were and the position that they were in, somebody with a motive could, in this environment, create the opportunity to cause harm. At the time of these crimes, none of the parents expected their baby to be at harm in the neonatal unit. Why would they even be suspicious? While none of the parents had any particular suspicions about Lucy, some of them did raise concerns about the care of their babies. Before bringing any kind of action against Lucy, the police hoped to find some kind of medical explanation for that many collapses. They kept on speaking with experts for reviews and for trying to find a reason for what had happened, and each time they were hopeful that someone will give them that explanation. But there was a sudden realization. They were looking at every possible angle. They consulted with the best experts in the country, and the only angle left was Lucy and charges being brought against her. The dots started to appear at the end of 2017 when police got preliminary updates from experts. It was in June 2018 before they had to make the decision and declare suspect status and criminality. Talking about the moment they realized they were investigating murders and attempted murders, DCI Evans said, quote, "This is really hard to believe, and I don't think we expected this at the beginning. We hoped that we wouldn't find any criminal offenses because that meant we were going to have to tell the parents that their children had been murdered. That was a milestone in the investigation because it's really hard to believe, I think, that somebody would do this. That's what the investigation team felt. It was a milestone and it was shocking, and we knew what we were about to embark on and take the families through, partly the acceptance and the realization from us as to how long that was going to take." End of quote. Evidence in this case was gathered in 3 areas: medical, investigative reconstructions, and analytical evidence. Many experts were needed to interpret medical records. Lucy had qualified as a Band 5 nurse in September 2011, having studied nursing at the University of Chester. During her course, she completed a number of work placements, most of which were at the Countess of Chester Hospital. She was moved from the neonatal unit to a clerical role with no further contact with children in June 2016. She was first arrested at her home in Chester on July the 3rd, 2018, with 2 further arrests at her parents' house in Hereford on 10th of June 2019 and on November the 10th, 2020. She was charged with the offences in November 2020. She had denied all the allegations during the course of the trial. And in our next part, we will cover the shocking evidence found against Lucy and even more. And with this we got to the end of part 1. Please do let me know what do you guys think in the comment section down below, and I will be uploading part 2 in a couple of days, so please be patient with me. And again, I want to thank you so much for your support and for all the words of encouragement that you gave me when I said that I'm struggling, and I just want to let you know that I slept it off and I seem to be doing better now. So anyway, I'll see you in the next video. For now, take care, stay safe, bye!